Epilepsy is not a disease. Epilepsy or a seizure, which is normally used by the public, is related to a sudden onset of electrical activity in some part of the brain. Either it can stay there itself or it can spread within the brain to create a problem. So, in fact, there are multiple varieties of epilepsy we normally see as a clinician. From the public point of view, they always think that anything where the patients bite the tongue, lose the consciousness, they fall down, they keep their hand and leg twisted for a few seconds, that is called as epilepsy from public point of view. Yes, that is the one type of epilepsy called as generalized tonic-clonic epilepsy. In the sense, the electrical activity has spread to the rest of the brain and brain shuts off and patient become unconscious and falls. There's some other variety where a small focal area within the brain, it could be hand area, it could be eye area of the brain, where it gets stimulated and patient get only that area specific activity in either the hand or eye, which we call focal epilepsy. But yet another variety where patients momentarily can do some vague activities like lip smacking, or they bite the tongue, they look around, they lose their own reality at that time for a few seconds, then suddenly they come back to normalcy, which we call as a complex partial seizure. In fact, this type of epilepsy is very common in children and young adults, but which is taken as though is a misbehavior rather than the epilepsy in the common term, and nobody comes to examination from the doctor's point of view unless if it repeatedly happens.